Good day, and welcome to Zoyols News. I'm Michael Reed. Concerns are growing over the Ebola response as health workers warn they may suspend their efforts over unpaid wages and challenging working conditions. The situation has raised fears that disruptions could affect efforts to contain the outbreak and protect vulnerable communities. I'm Michael Reed. The news begins now. Sometimes, a small detail we overlook can prove fatal. As the outbreak grows, health workers say they are battling more than the virus. After months treating Ebola patients, Kayampa says she has not received a single government paycheck. The mother of 4 is among dozens who have protested delayed wages and threatened to boycott work, at a moment the World Health Organization warns the outbreak is escalating in the DRC. Since mid-May, the virus has infected at least 3,874 people and killed 1,751, according to the Congolese Health Ministry. It has been described as the largest Ebola outbreak ever reported, detected across the DRC and Uganda, though Uganda later declared itself Ebola-free. Transmission continues accelerating in eastern Congo, surpassing the country's 2018 to 2020 outbreak in speed. Only the 2014-16 West Africa epidemic was larger and deadlier. DRC Ebola surging. Bunia, capital of Ituri province, is the epicenter, with over 90% of confirmed cases recorded there. This outbreak involves the Bundibugyo strain, with no proven vaccines and limited treatments. Conflict in eastern DRC makes it harder to reach communities already weakened by displacement and poor water, sanitation, and health systems, Mercy Corps says. Aid agencies say mistrust and misinformation about Ebola, and resistance to restrictions on traditional burial practices, have fueled hostility toward health workers. In late May, demonstrators forced their way into a treatment facility seeking relatives' bodies, triggering chaos as gunfire erupted and patients were moved to safety. Similar violence has continued, complicating efforts to contain transmission. The UN reports at least a dozen facilities have been attacked due to fear and deep mistrust of outside authorities. At Bunia's Alikia Ebola Treatment Center, run by Médecins Sans Frontières, the 90-bed ward is at full capacity, with patients often arriving critically ill. Kayampa says there are too few nurses and that accidents or attacks by aggressive patients can still lead to infection even with protective gear. We're sacrificing our lives for the people, Kayampa says, recalling that early on, staff treated patients without protection and some became infected and died. Yet she says unpaid government wages, not only the virus, have pushed many workers to the breaking point. MSF bonuses help, she adds, but they do not replace the salary she depends on. Kayampa says she has worked since June without receiving any wages, partly due to a misspelling of her name in payroll records. She stopped work for 3 days in protest, then returned hoping the issue would be resolved, but says she is ready to walk out again. A DRC government spokesperson acknowledged payment delays and said outstanding wages were being processed amid wider funding pressures. The communications minister says delays stem from verifying who was deployed and ensuring payments reach the right recipients, promising anyone officially listed will be paid. MSF says the protests concern government compensation, while MSF continues meeting its own staff obligations. Aid groups warn the Ebola response depends on health workers being compensated promptly for dangerous work. Aid workers say frontline staff carry the greatest burden, treating patients, preventing infections, and sustaining public confidence, while facing major personal risk. They warn that without equipment, protection, timely pay, and support, interruptions give the virus more time to spread. Kayampa says she will boycott work until she is paid. Better still, I will leave this job to try my hand at other activities that will bring me money. That is the latest on the growing concerns surrounding the Ebola response and the challenges facing frontline health workers. We'll continue to monitor the situation and bring you verified updates as efforts to contain the outbreak continue. For more breaking news and in-depth coverage, stay with Zoyols News. I'm Michael Reed. Thanks for watching.